If you are looking to replace missing teeth, dental implants are typically considered to be the gold norm. They're durable, last a long time, they seem and feel like they are as natural. But for those suffering from gum problems, the concern remains, should they have dental implants? In this clip, we'll look at the link between gum illness and dental implants and if it's feasible to get this procedure while battling the existing issues of periodontal disease. Understanding gum disease. Before diving into the issue regarding gum disease and dental implants, it's essential to understand the basics of what gum disease actually is. The condition, commonly referred as periodontal diseases, is a condition that causes the gums get inflamed and damaged. The result can be several symptoms, which include swelling, redness, bleeding, and when severe tooth loss. Gum disease is caused an accumulation of plaque in the teeth as well as on the gum line. If it is not addressed by the bacteria that are present in plaque, may cause the gums to break away from the teeth, forming pockets that allow for more bacteria to collect. As time passes, this may result in injury to bone and tissues that support teeth. The result is tooth loss. The relationship between gum disease and dental implants. With an overview of the gum disease, we can begin to explore what it has to do with dental implants. One of the primary elements in determining whether an individual is eligible of dental implant is overall health of their gums and surrounding tissues. As dental implants are put directly into the jawbone, it's essential to ensure that the bone structures underneath are free of inflammation. When patients suffer from gum problems, it could not be feasible immediately for them to undergo the procedure of a dental implant. An active infection on the gums could impede the healing process and also increase the likelihood of failure. Furthermore, if there's an extensive loss of bone due to gum disease, it could not be enough support available for the implant to succeed. This does not suggest that patients suffering from gum disease can't be excluded from receiving dental implants. The first step in the process is to deal with the root of the problem and to bring gum disease in check. This could mean deep cleaning methods, including scaling and root planing in order to get rid of tartar and plaque from the gums and teeth. In certain instances, surgical intervention might be needed to restore injured tissues and restore dental health. When gum disease has been treated successfully, then the next thing to do is to examine the state of the bone inside the jaw. To allow dental implants to succeed, the patient must have adequate bone health to provide support for the implant. If there's a lack of bone because of gum disease or another cause or other causes, procedures such as osteografting might be needed for the growth of bone and provide a sturdy basis for implant. Being diagnosed with gum disease doesn't necessarily mean that you are unable to have dental implants. When you are treated properly and with carefully planned planning, those who suffer from gum disease could be a candidate for this life-changing procedure. But it's important to consult with your periodontist and dentist to treat any existing dental issues prior to starting by undergoing dental implants. When you make the right actions to protect your gums are healthy and jawbone, you'll enhance the odds of having a positive outcome and benefit from the numerous advantages which dental implants bring.